Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello everybody, I'm here with Sharina, Recovery Mum, as promised, and we're going to be looking at a number of the questions submitted in the community section on my YouTube channel, and I really appreciate that. I appreciate taking the time. Really some fantastic questions, and really got Sharina and I talking about these different topics. It's so interesting. And we could really see that there was a lot of energy and emotion put into a lot of these comments as well. So we'll get started. I'll just start with the first comment, kind of go in order, and Sharina and I will tackle them as best we can. So with the first question, we see here this is the borderline personality disorder in relationships. Should have mentioned that before, but this is the relationships category. And the subscriber here would like to know, when it's not borderline personality disorder, what other types of disorders could be confused with the behaviors we would think associated with borderline personality disorder? So you want to take a stab at that, Sharina?
Well, do I want to take a stab at that? I will give it a go.
Okay.
Because I think, well, a lot of the personality disorders can kind of overlap. And the one thing, because when I read this question, this is what really bothers me, is I've been in, I was going to say so many relationships, but I've been in relationships before where I do something and immediately someone says, that's the borderline. And it's like, no, not everything I do has to be to do with the borderline personality disorder, because a lot of people out there can sometimes struggle with jealousy or feel like a bit low in themselves, and it doesn't necessarily mean it is borderline personality disorder. Like I said, before, lots of people can have some of the traits. It doesn't mean they have enough to be diagnosed with BPD. And also, like I said, the other personality, especially the cluster Bs, you can often see a lot overlap. Mm-hmm. I think that's...
No, that's good. You know, this is an excellent question. I think this really not only speaks to the treatment side, or the client side rather, but to the treatment side, the professionals that have to distinguish all these different symptoms and categorize them. It's not always easy, and we make mistakes all the time as clinicians. I think the big mistake I see with borderline personality disorder is probably its confusion with bipolar disorder. I think that's one of the most significant confusion points I see, because for a short time anyway, bipolar disorder can seem very similar, especially the mania component and even the depression component. But I agree with you, some of the confusion would be with the cluster B personality disorders. Narcissism can seem similar at certain times, histrionic can seem quite similar, and even sometimes antisocial, particularly in a relational context, can seem pretty similar. So just because somebody has borderline personality disorder doesn't mean that they don't have other comorbid disorders as well. So you could see a symptom that's actually explained by two different disorders. So it's very hard to sometimes tease these out and get precisely and say, well, this is definitely only borderline or only narcissistic personality disorder, bipolar disorder. A lot of times as clinicians, we just have a lot of different symptoms we're looking at, and we just do our best to categorize so that we can start a treatment protocol. So I think probably one of the best indicators of borderline is if the symptoms endure for a while, an enduring pattern of inner experience. You know, that would be my thoughts on that one.
Sorry, ever so quickly, I'm hearing from a lot of people, and I'm pretty sure I read it in the comment section here as well, that regarding borderline personality disorder and, is it autism? Mm-hmm. Or ASD?
Autism spectrum disorder.
Yeah, that is coming up a lot. I'm hearing particularly to do with women. I don't know enough about autism spectrum disorder. Did I say that right?
Autism spectrum disorder, yes.
Yeah.
Yeah,
Yeah.
that's something I actually did a video on that a while back, and that's something we're seeing a lot more research on, a lot more interest in, is that overlap between autism spectrum disorder and borderline personality disorder. At first, you wouldn't think there would be a lot. They seem fairly disparate in terms of diagnostic classifications, but yeah, we're seeing increased interest in that, and we're also seeing increased interest in the vulnerable narcissistic component, which of course isn't captured anywhere really too well in the DSM because the narcissistic personality disorder is the grandiose
Mm.
narcissistic traits. So yeah, that's something I want to read more on. I have the one video, but I want to read some more on what we're finding about autism and borderline. I think there's definitely something there. There's a lot more overlap than, like I said, than anybody would think.
Yeah.
So, all right. So the next question here, again, this is in the relationships category, is asking about mothers who have borderline personality disorder and have reached what the subscriber refers to as malignant or severe end of the spectrum. So I guess a pervasive presentation of borderline. And it affects the individual who has it and also the adult children. Does it ever get so bad that the adult children would have to take elder care lawyer or talk to an elder care lawyer or a doctor to help them? This is an interesting question. So really kind of looking at borderline as an incapacitating illness, and is there a time where a son or daughter would have to jump in?
Yeah. Okay, well, yeah, this is really interesting because you don't hear about this so much. So
Mm-hmm.
often you hear about parents saying, my child has it, or grown-up children saying, my mother had it as I grew up, but not so often grown-up children saying, look, my mum is still like this and it's getting so bad, we
Mm-hmm.
need to step in. I don't know, like, what the procedures are in America. I I believe over here, if your mother was, say, becoming a danger to herself or to other people, then you would be within your rights to step in and something would be done about that to protect her. It might be putting her onto a mental health unit where she is safe. But unfortunately, with BPD, often the case is, unless the person with it wants to get help, you can't force them. And to be honest, it's pointless trying to force them if they don't want help anyway, because if they don't want to help themselves, they're not going to learn the skills or do the work that they need to do. They're probably not likely to be self-aware at all. They will be blaming everyone else, and actually acceptance of the disorder is a huge step to take. But you often see, like, people out there, they do not accept they have this disorder. They blame everyone around them, and they're just not willing to get the help. So yeah, it is a difficult one. But I would say if she was a danger, like I said, to others or to herself, then possibly there are things that can be done.
Yeah, this is interesting. This does bring up some of the differences between United Kingdom and United States in terms of the actions that can be taken, what's considered incompetence. When does somebody reach the point where they're not competent to care for themselves or they're a danger? I've seen a lot of presentations that involve civil commitment, which is our level where somebody's overseen by the courts. So
Like sectioned, is that kind of like being
I
sectioned?
think it's something similar to that. Yeah, it's so the courts oversee to some extent the care. The person has to receive treatment, and then the treating clinician has to report to the court every so often and say, this is what's been happening. My experience with it, though, is that the bar for civil commitment is extremely high. Now, civil commitment might just be one way to remedy this. I mean, there's other ways more informally to address it. But in terms of that, it's very high, usually only reserved for psychosis, some level of psychosis. I see it most often with schizophrenia and schizoaffective disorders. So with borderline personality disorder, of course, can be a severe disorder. It has severe symptoms, but I don't know if it really gets the respect that it should in terms of the dangerousness component. I don't think that it usually elicits the same response from the courts, because again, it's viewed as extreme personality traits. So people might say, well, it's just, a lot of extroversion or low agreeableness or something. They don't really understand that when those traits come together in a certain way, they can lead to suicidal behavior, impulsivity, all the symptom criteria. So that's what I mean by it doesn't really seem to get the same level of respect. So I would say it's an uphill battle, but with borderline specifically. But what you can use, and you touched on this, I think that was a good point, is you can use the behaviors. If there are dangerous behaviors being exhibited, that's where your anchors could be. Look, I'm seeing suicide attempts or suicidal ideation or something. That would get somebody interested in intervening, right? A clinician, the courts, whatever. Whereas more subtle symptoms like, oh, they're really damaging in relationships, that's never going to get anybody's attention. You're never going to get anybody committed based on that, rightfully so. But I can appreciate that there's a lot of gray area in this too. It's not always clear when somebody's no longer competent to care for themselves and when they're a danger. We deal with these questions all the time as clinicians. No easy answers. So probably the first step would be look out for objective things that you can see that are dangerous and report those. Report whatever's going on, whether it's dangerous or not, you never know. But also, as you touched on, see if there can be some level of ownership and acceptance, and if the person with the disorder will voluntarily seek treatment. That's always the best. Forcing people in is challenging.
Yeah. I was going to say as well, like, I don't know how it again works in America, but if, say, the mother was under a doctor, like had a doctor, although the doctor cannot give the family any information, that does not stop the family actually phoning and giving the doctor some information, saying, we just want you to know this. And so if you're thinking they're like self-harming or doing something, that nothing stops you from talking to them, but they are unable to talk to you unless your mother would give permission.
Right, that's an excellent point. And I've seen that all the time. It's kind of like it's like a subtle thing where we're driving like between the rules, right? So I can't necessarily have a conversation with somebody, but I can always listen. They can always send documents, emails, whatever, and I could consider that. But it does get into a tricky area. It gets into ethically a little bit of a delicate area. But yes, certainly if you have information, especially dangerous things, bring that forward and present it, to everyone who's relevant in the situation, and usually they will listen. Yeah, and oftentimes I found too, even when people have severe illnesses, they will oftentimes consent to family members being involved in their care. And I think it's important to view that as a privilege. In terms of a family member, you have to view that as a privilege and not try to abuse that, try to use that responsibly. But that gives you excellent access into the therapeutic process to try to get in front of problems early. So, excellent. All right, so this next one, this one's a little bit longer, so I'm going to kind of paraphrase it a bit. But I can see it's infused with a lot of emotion. We talked about this one before. So this subscriber is just diagnosed with borderline personality disorder, and essentially what they've realized is that in their relationship with their boyfriend, in her relationship with her boyfriend, that the borderline personality symptoms seem to be explaining the fights and jealousy and a lot of the behaviors that she was observing in that relationship. And this is kind of, in reading this, you get this impression not only of the pain that's suffered, but it's kind of an eye-opening moment. Like when she realizes, wow, there's an explanation for what's been happening. So what are your thoughts on this?
My cat squeaking next to me. I think it's amazing. I think the fact that this girl has all of a sudden, like you said, it's this eye-opening moment, and this is huge, like, because it shows self-awareness, being able to notice, like, what thoughts and feelings have caused what behaviors and when. And that is a huge step on the road to recovery. And it might be like, some people might think, oh, it's just damaged everything. But actually, no, now you are aware of it and you can see it. Now's the time that you can start making changes, because prior to that, there was no way you could make changes because you just didn't know what changes needed to be made. So I think actually the relationship stands a really good chance now that she is aware, like, of how the borderline has affected the relationship in the past.
Yeah, I agree. I mean, I think probably one of the problems that we see too often is that people never have this moment where they connect their behaviors with a classifiable disorder that we understand, that we study in science, and we kind of know what's going to happen. And they stay in this cycle, the ego-syntonic cycle, right, where they look at their behavior and think it's acceptable, right? It's a lack of insight or lack of awareness. So just to have that moment to say, gee, this really does seem to connect with these symptoms, and it's not just random, or it's not just how I feel. It actually is a construct that's studied. I think that's an important indicator, right? And something that I would probably take immediately to therapy. I think this is the time to go right into therapy and say, I'm obviously there's a diagnosis here, so I'm sure there's a therapist, and say, I want to build on this insight. I want to try to reconstruct what's helpful in terms of the past and what went wrong, but also look forward and what can I do now to manage these symptoms. I think another part of this particular comment had to do with kind of how do you know what's real and what's not, right? Because the symptoms always feel real, right? They always feel like they're correct. That's what I mean by real in this context, like correct. They're always giving you the right indication. Accurate, I guess the word would be. And it gets confusing with the disorder because now you have to wonder, am I seeing things clearly? And my advice here is, look for objective sources. Look for people in your life that can support you and say, look, this behavior, you being mad at him for doing this, that makes sense. Yep. But you throwing the chair at him, that's not okay. Like something, right? Some point where you can have somebody objective saying, this is our opinion as individuals who do not have a emotional investment and we don't have the disorder, and I think that's invaluable. So the clinician can probably do that to some extent, of course, and then family and friends, whoever is supportive and positive. So excellent question. Yeah, we talked about that one a little before, like I indicated. All right, so next one here, again on relationships, is okay. This individual hasn't had a successful relationship with anyone for years, and they want to see an explanation of emotional impermanence. Emotional impermanence.
Would that be emotional instability?
Yeah, I'm looking at that word in impermanence. I'm trying to figure that out. I guess that would be not permanent. So I guess that would be the up and down. Right. Exactly.
Yeah.
Exactly. That's what I was thinking. So the affective instability criterion. So any thoughts on that?
So what was the question again?
Just looking for an explanation of that emotional impermanence construct.
I'll let you go first.
Well, I think this is tough. I did a video a while ago, not long ago, on the core of borderline personality disorder, where I gave my opinion on what's at the core, and I said identity disturbance. And I think that I'll stand behind that. I would say the core is identity disturbance, and the reason I mention that is because the emotional dysregulation, I feel like, is an offshoot of not knowing who you are, not having a solid sense of your values and what's accurate, what's correct to do in your life, like what steps to take. Losing identity and losing a sense of self compromises really all emotional stability, right? It puts it all in jeopardy. So I look at the affective instability as a poor sense of self, as a product of a poor sense of self and poor identity. That's how I view it. So, and of course, it manifests, as we know, in a variety of ways, but mostly in relationships where, you can love somebody one minute, hate them the next. So I guess it also would really tie to that intense relationship, unstable relationship criterion as well. Those are my thoughts on it.
Yes, I just feel I think, because I was reading some of the comments and everyone's like, well, I think it's something different, and I think maybe it is different with different people, but for me, I definitely believe the core of BPD is that fear of abandonment, and I think it stems from very, very young age, and it can affect people completely differently. Whereas to the point that people might not even realize they have a fear of abandonment. They just might not get into relationships. And they think, yeah, so I don't have a fear of abandonment, I don't get into relationships. But actually, the reason they don't get into relationships is deep down because they have that fear. And for me, I can remember having that fear from probably about 2 years old, thinking like my parents weren't going to come home, and they had not done anything to make me feel there was no way they were coming home. I had a loving mother. So most people I speak to, because obviously there's the 9 traits, and to get diagnosed you just have to have 5, but nearly everyone I speak to with BPD always has that fear of abandonment.
Yeah.
I don't believe they all have an unstable self-image. Some, because I've seen people say, actually, my self-image is fine. I mean, mine was really unstable, but yeah, that's my opinion.
No, I think you can make a good argument for the fear of abandonment as a core. And I was reading in the same article I was reading before, when I was talking about the core borderline with the identity disturbance, there was a reference in there to just how strong the fear of abandonment can be. And it was something to the effect of, it can be so powerful that you worry that if somebody leaves you, you would literally cease to exist.
Yeah.
Like that's, so it's not just like a small fear.
No, exactly. That's
right.
the thing. It's not. And that's the worst thing. Like, I did not realize I had a fear of abandonment until I became self-aware. And then I was like, oh my goodness, this affected every area of my life. And it was huge, but I just wasn't aware of it. It was just like so ingrained in me. And it wasn't just this fear of someone might leave me. It was, they are going to leave me. It was fact. Everyone was going to leave me. And yeah, it's tough. It's a tough one to live with.
Yeah, so it's easy to see how that can connect to that affective instability as well. Having that intense fear, especially over a long period of time, that would really build.
I think for my unstable self-image, it was kind of, I wanted to fit in because of that fear. And so I would desperately try to copy people and be a chameleon. And then over time, I just didn't know who I was. And it was all down to wanting to fit in, wanting to be accepted, not wanting to be abandoned.
Yeah. So it's experienced in different ways at different times. And I think that's one of the things that really makes the disorder hard. Really, that affective instability, wherever it comes from, has far reach into a lot of areas of your life. So yeah, really challenging. So I'm glad. I'll have to look up that emotional impermanence just to make sure that was, I got that right. But I think that's what it is. So if we didn't answer that question, we answered what's affective instability really well, in case anybody would have that question.
We apologize.
So the next one here, this is a little bit longer one too. I know somebody who might have the disorder. Looks like she has about 8 of the 9 symptoms over the last 10 years. Not sure if the diagnosis is present, been good for a few months, but then had another explosion with a lot of rage and claimed that she was abandoning her. So the individual potentially with borderline personality disorder claimed that the subscriber was abandoning her.
Yeah.
I don't know what will trigger it or what will happen. I need to know what to say when she claims I'm abandoning her. I want to validate her, but I don't want to enable her. So this touches on a lot of the themes we've talked about.
Yeah, yeah, and unfortunately, that's the thing with BPD. We can go a long period of time where everything seems to be going okay, and then pow, it kind of all blows up. And for those around us, they just never know when that's going to happen, but they're constantly waiting for it to happen. And the chances are high that it will. Like my advice would be, like, if you're a good friend, to sit down and talk to her while things are like okay, and kind of explain and say, look, if this happens and you start thinking I'm going to abandon you, and you're shouting that, I'm going to walk away, but I'm still your friend, I will come back, because it's kind of putting in boundaries in place. Letting her know that you are there, you do love her, you are friends with her, and do that while she's like stable, say, not in a crisis. And then if a crisis happens, just reiterate, just say again what you said prior, and hopefully, I can't guarantee, but hopefully it will trigger that memory that you have had this conversation with her, and she may calm. And if she's getting violent, if it's abusive in any way, then you just have to state clearly, like I said, state clearly, like, I love you, I'm your friend, I am not leaving you, but right now I have to go, and I will be back later, or we will talk later, and having firm boundaries in place.
Right. So trying to work within the limitations of the disorder, but also protect yourself with boundaries. One of the trickiest things with borderline personality disorder, and there's no shortage of tricky elements to the disorder, is this accusing people of abandoning you, and then needing them to be strong, right? Needing them to hang in there. And oftentimes, of course, they will, at least in the short run. But then repeating that behavior so many times that it does become that self-fulfilling prophecy. And now the person's going to say, well, look, I didn't abandon them. I did my best, but they kept coming at me over and over and over. And I've seen this play out so many times. Yeah. This is an extremely common theme. And you'll talk to friends, relatives, those you have permission to talk to in the therapeutic relationship, and they'll say, look, I tried. Right? I'm not the bad guy here. I tried, and I repeatedly said that I wouldn't leave, and then the abuse kept on coming, or the accusations, and at some point I just wore out.
Well, when I used to go through this, and I would kick off in a big way. I could be physically violent. I would literally be saying, get out, get out. And when they left, I'd be hysterical that they had left, even though I'd actually said, get out. And then I'd be crying, phoning, you left me, threatening to self-harm. Mm-hmm. And yeah, it was like, looking back, it's really tough on those around, because they're being literally pushed away. And yeah, it's like that book, what's it called? I hate you, please don't leave me. Isn't it?
Yeah, the way I think of it is that it's the use of a lot of blunt instruments, when a little bit more finesse would probably go a long way, right? So it's the extreme, I hate you, I'm going to self-harm, I'm going to show you, when probably talking through things rationally would be a better course, but those emotions are so strong, they really interfere. Yeah. So there's no simple answer to that question, unfortunately.
One thing that did it work with me? Well, I read in a book, I think it's called The Brain Child, and it's actually about children and how toddlers, when they have their toddler tantrum, that prefrontal cortex shut down, there's no reasoning with them. But one tip you can do is don't say anything, don't fight them, don't walk away, just hug them and just hold them tight. Just hug them. and that's it. And eventually they calm down. And yeah, it kind of makes me think, because they say that's kind of how we are when we're in that temper thing. And maybe that's something that works. I wouldn't say it would work with everyone, because some people might just be like, get away from me. But maybe your friend would like a hug.
Yeah, with everybody, I guess it's different, right? And some approaches might work and some might not. So part of it would be knowing that person and knowing what you can do and what you couldn't, and what would reassure them and what might not. So
Maybe
yeah.
asking them, like, when that happens next time, what do you want me to do? Like, and actually get them to tell you what they want you to do.
Yeah, yeah, definitely. Yeah, that would be better to have a plan going in advance rather than just kind of shooting from the hip and trying to figure
Yeah.
that out. All right. So the next question, this one again, as I mentioned, on relationships. Does someone with borderline personality disorder often use people-pleasing behaviors as an unconscious, compulsive coping mechanism for fears of rejections? And can you give some examples?
Oh, absolutely. Oh, I was like the people pleaser. And this is what I would do. Say, if I was in a relationship, I would want to be just the perfect person. So I remember one time I'd gone on like one date with a guy, and I was at his house, and he had a stack of dishes piled up, and I washed them all. Like, I washed them all, just because I wanted him to think I was so amazing. And I've kind of done that in like a lot of my, not just like romantic relationship, but with friendships, going out my way, because I wouldn't do it like consciously. It was an unconscious thing, but I know deep down I wanted them to be like, wow, she's such a good friend, she's amazing. And again, I don't know if that kind of stems from the fear of abandonment, like you said, fearing rejection. But here's what would happen with me. I could do this for a while, but there would come a time I would feel it's not being reciprocated. They are not being as nice to me as I am to them. Bearing in mind that I'm going OTT with it. It's, when I first got with my ex, I would make him these lunch boxes, and he would have all different, like, variety of different kind of salads, rice salads, bean salads, like absolutely everything in there. And I'd go to all this effort cooking and that, and it would go on for a while, but then I'd think, he's not really grateful. He doesn't do this for me. What does he do? And the resentment builds. And it builds and it builds and it builds. And then I would split. So I would go from wanting people to think, I hate them. They haven't like reciprocated my love. And I would see them as all black. They were horrid. And I would completely cut off and do the opposite and go really cold. And they didn't know what they'd done, what happened, because I didn't say, oh, well, I make you lunches every day. You don't say thank you and make me lunch. I didn't tell them, but that would definitely cause me to split and start thinking in black and white. And resentments are never good. They literally eat away at you, and they will either come out either splitting, or you will just explode with anger.
Right. So in essence, the people-pleasing behaviors kind of get integrated into the future behavior. They're used as evidence.
Yeah.
Right. So yeah, they everything kind of plays a part. Another thing I think of with this question is I think of dependent personality disorder, because sometimes with dependent personality disorder, we see a lot of people pleasing, but we wouldn't expect to see the cycle that you're talking about. So that's really what differentiates it from borderline. Because with dependent personality disorder, the people pleasing, it can stay there forever. That can be kind of a
Wow.
permanent personality trait where everybody the individual encounters, they're going to go over the top and be helpful and polite because they're looking to latch on for support.
Wow. Do they end up getting resentful at it or not?
Dependent personality disorder is interesting. I would say normally, no. I would say resentful is probably not one of the characteristics I would expect to see. there's definitely a link to depression and normative sadness as well. But yeah, not so much resentfulness with dependent personality disorder. It stands alone. Dependent personality disorder is in cluster C, so it's anxious, fearful. So the
Okay.
kind of the primary emotions are going to be like a nervousness and a worry about losing support.
Wow.
But you see some overlap with borderline personality disorder because that fear of abandonment connects pretty strongly over to dependent personality disorder. But dependent personality disorder doesn't have any of the anger components. It doesn't typically have as strong a connection to suicidal behavior and impulsivity and things like that. So yeah, it's an interesting disorder. We don't see it diagnosed as much anymore. But if you only saw the people pleasing and no other symptoms, you could think borderline, you could think dependent, and a few others, and you'd really have to see more information to know
Yeah.
what's going on there. So, well, that brings us to, we're a little over 35 minutes at this point, so this is probably a good place to end, wrap up this video. We have a
Yeah.
lot more questions that we'll cover in the future. There are many more, and again, I'm very appreciative of those who were submitted, and we are definitely making an effort to get to each and every one. But we do want to try to spend a good amount of time in each one, so it's going to take us a little bit to get through them all. Any last words here on this video? Any thoughts here?
No, thank you so much again for having me over on your channel.
Absolutely.
Yeah,
Absolutely.
it's been
Always my pleasure. And as usual, you had some great insights on these questions, ones I would not have thought of. So very good and adds a lot of value. I really appreciate you coming on.
Thank you so much. I love getting your insight on the different, because I'm like, I know about BPD, but all the other personality disorders, they fascinate me as well. And you're the guy to go to that can explain it so well. So
Well, thank you
it's
very
great.
much. So we'll sign off here. So as usual, please leave comments if you have any thoughts about this video, maybe things that we got right, things that we missed, other things you want to add. Borderline personality disorder is certainly a complex disorder, and we see a lot of different kind of variations out there. So thanks again, and we will catch up with you again as soon as possible.